bleeding during their brush. Is that normal? Why does it happen?
Sometimes a toothbrush prick.
So what is the ideal direction or method to brush your teeth?
We are not scrubbing our floors. We are not mopping. So the bristles of the brush has to do the work.
When is a root canal necessary and when can it hold without directly going into a surgery?
Hair is start on the surface of the tooth until and unless it.
Can you tell us who is a prosthodontist and what do they do?
Your best smile design comes from a prosthodontist.
Wow.
See, smile correction can be done.
We have been seeing a lot of advertisements related to toothpastes. What is this tooth sensitivity? Why are our teeth sensitive to cold?
Naturally, we have a layer called enamel. First layer of the tooth is an enamel, which protects us from all these kinds of temperature changes.
Can that be reversed with these toothpastes as being told in the advertisements? The varieties of toothbrushes: hard, medium, soft and ultra soft. What do you recommend for your patients? What is an ideal cost of smile correction? Missing teeth can affect their speech. Is that true? So we have heard about this charcoal neem toothpaste. Are these necessary? Are these important? Complaints, complaints, and complaints. We have a lot of complaints on our day-to-day life. Starting from politics, pollution, public, our complaints are never-ending. If there is someone that never complains, no matter how much you trouble them, I can think of our teeth. We eat a lot and we consume a lot of food on a regular basis. But I never saw any teeth complaining that you have been putting me under a lot of pressure. Or maybe it is complaining and we are not focusing on them. Tooth decay, bad breath, yellow teeth, root canals, broken teeth, as well as wisdom tooth. There are a lot of tooth related conditions which trouble us on a day to day basis. And believe me, with my personal experience, when a teeth or a tooth pains, it is unbearable. And I'm sure a lot of you must have experienced or worried about experiencing these conditions in your day to day life. Teeth has become a part of our life starting from our childhood age, and it is going to be there with us throughout our life, at least till the elderly ages. They fall off by themselves. And we all know the importance of teeth. It helps us grind food. And when you speak, teeth also helps us in pronouncing certain words in a certain manner, and it makes our sentences as well as our speech more soothing and more sweet. So we have a lot of questions around teeth. We have a lot of questions that are basic enough. We probably know it and we do not follow, or we do not know it, so we don't follow. So to uncover all these questions, we have Dr. Harika Y. She is an MDS prosthodontist, crown and bridge specialist, joining us from Kukatpally, Hyderabad. Welcome to Medicas video podcast. My name is Varun. I hope you're all doing well. Let's directly go into this recording and this episode and uncover questions related to our teeth. Hello, Dr. Harika. How are you doing?
Hi, I'm good. How are you?
Thank you. I'm good, man. Thank you so much for asking. Dr. Harika, we know that we have dentists around almost every street corner, and we have been visiting dentists for a lot of issues. A lot of them would have visited dentists. But I am hearing this word prosthodontist, though I am aware of who is a prosthodontist. For the sake of our audience, can you tell us who is a prosthodontist and what do they do?
However, I'm a prosthodontist. I create smiles. Your best smile design comes from a prosthodontist.
Wow. Wow. Fantastic. So when you say that you design smiles, this is like you're giving a new confidence and a new, probably a face to an individual who have not been confident and who have been embarrassed because of the smile or the teeth misalignments. So can you give us a little more details about what a prosthodontist can do or will do, doctor?
Actually, there will be a lot of missing tooth in many individuals. Uh, every teeth in the oral cavity is very important. Replacing oral, replacing those teeth back into the oral cavity is equally important as well. When you unfortunately, lose your natural teeth, it has to be done in some other way. So we restore that lost tooth. There are many types and varieties how we can restore this lost tooth. So my specialty, prosthodontics, is related in restoring these teeth and also correcting many malaligned teeth through prosthetics and also in any other way on.
How imperfect is a perfect? I mean, just like we say in the olden days, there are certain people who can catch the issues or who can catch the talent quickly. So, as you said, that you are a smile corrector and a prosthodontist who actually replacing and restoring the missing teeth and also any alignment kind of issues that they have. If I show you an individual, will you be able to tell them, define the pattern of their teeth, ma'am?
If I see an individual and say that there is something that has to be done in the oral cavity, that means it must be related to a major disease or malalignment, or immediately after seeing it, it has to occur like they need some treatment. Then only we say they require any treatment.
Okay, okay. Ma'am, is there an instance where a person visited your clinic saying that, I want a smile correction? What was your immediate observation and what was the advice you gave to that person?
Every day we see patients coming and asking for a smile correction. There is a patient who has a gap in between in his front two teeth, who is not confident in smiling. When we corrected the smile, when the gap was closed and a perfect closure has happened, he was very confident in smiling and he is now an outspoken person.
Oh, fantastic. Ma'am, this question is something which I want to ask you because we see this in the kids where when they lose their teeth, their milk teeth, certain words they cannot pronounce properly,
Yes.
right? So alignment of the teeth, or rather, missing teeth can affect their speech. Is that true?
Yes, it is true. When your front teeth are, when you miss your front teeth, the when you speak, definitely teeth, the tongue, the lips, all these components will definitely help you in speaking. But for certain letters like S, Y, and particularly P, you need lips and then teeth for the sounding, for more better sounding. When you miss your front teeth, it is only the air that is flowing out and your teeth are not supporting. Definitely there will be an interruption in the speech.
Okay, okay. Ma'am, off late, I think in the past couple of years, we have been seeing a lot of advertisements related to toothpastes. And the major problem, what they are showcasing, I don't know if that's really a problem or if that's a marketing gimmick. You have to answer that for us. What is this tooth sensitivity? Why are our teeth sensitive to cold?
Naturally, we have a layer called enamel. First layer of the tooth is an enamel, which protects us from all these kinds of temperature changes and acidic foods or sweet foods or cold foods, hot, any beverages or any food. There are many chances as we go on, like an aging or 30s, 40s, and above, there are the chance that our enamel gets little eroded. In some cases, there is a severe disruption of this enamel layer where it might cause your teeth go to sensitivity. Depending upon the level of sensitivity one individual can, if at all it is beyond the acceptance, then we can go for certain treatments which initially includes tooth sensitivity desensitizing toothpaste.
Okay. Okay. So the actual problem, which is tooth becoming sensitive to certain temperature-based beverages, is true in nature. Can that be reversed with these toothpastes, as being told in the advertisements?
It cannot be reversed as such, it cannot be reversed, but it can be masked with continuous usage of these toothpaste over a period of time. Like it will take some consistent usage of 2 to 4 weeks, where the sensitivity, the gaps and that particular area might get remineralized, or there is a chance that it can masked, and the sensitivity levels will definitely come down depending upon the severity.
Okay, okay. Well, there is a very big market, especially for kids dentistry. We are talking about the toothpastes and toothbrushes too, right? Do you think kids definitely need a different toothpaste in comparison to the adults?
Yes, it depends on the formulation of the toothpaste, where you have a lesser amount of fluoride and lesser amount of abrasives, toddler or child tolerating flavors. So definitely, we need a different toothpaste for a kid. Right from
Oh,
your first tooth eruption, we need a toothpaste. Depending upon the usage, compatibility to the flavor and all, we can choose our toothpaste.
okay, okay. And when this is a routine for almost all the individuals around the world to brush in the mornings as soon as they wake up. And they take their toothbrush and they apply the toothpaste on the top layer. As soon as you take the toothbrush and paste into your mouth, automatically the toothpaste on the top gets fallen off. Is there an ideal way to apply toothpaste on a toothbrush?
There is an ideal way. I can show you with
Sure,
a toothpaste and brush.
sure, sure, ma'am.
Ideally, for an adult, you can use so much of the toothpaste.
Ma'am, can you lift it up a little bit? Okay, okay, got it. Right, right, okay. And for the kids, should it be
It is a
half of?
pea-sized amount.
Okay, okay. And is there an ideal way you need to brush, ma'am? Because a lot of people keep brushing it like you're brushing your clothes. So, what is the ideal direction or method to brush your teeth?
See, the bristles of the brush has to do the work. We are not scrubbing our floors. We are not mopping. So the bristles of the brush has to do the work. It is not something you just go around and hardly brush it, brush it, brush it. No, you're damaging your teeth definitely. A very small amount of paste is also is required. You actually need a paste for your fresh breath, and some components in the paste which claim that they are anti-cavity and antibacterial properties. So
Okay,
the main reason is those bristles have to remove the layer called plaque on your tooth surface.
okay,
So
okay.
a gentle brushing and a circular motions on the top of the teeth and then surfaces, and then angulating it at the 45 degrees at the line of your gum and the teeth should remove all the plaque on your teeth surface.
Okay, okay. And certain people complain of bleeding during their brush. Is that normal? Why does it happen?
See, generally, sometimes a toothbrush prick or that deposits on the tooth while you're brushing, very little amount of bleeding is okay, it is normal. But then, if your bleeding is persistent and it is continuous and it is not reducing, then you must definitely visit a dentist because it is leading to gingivitis and inflammation on the gingiva. That means there might be a deposits on your tooth or which is leading to inflammation, and it is if it is not treated or not resolved, it is definitely going beneath and it is progressing towards your bone.
Okay, okay. Ma'am, when it comes to this toothbrush and toothpaste market, let's first talk about toothpaste market. There are a lot of variety of toothpaste. Flavors different. Some toothpaste companies say they have salt in it. Some of them say they have cloves in it. Some of them say they have something else in it. So why are there so many toothpastes? Is there no ideal toothpaste combination that one can actually pick up, or should they really be focusing on based on their tooth or maybe their oral habits?
All these are coming into the trend just because we as Indians believe in our traditional methods. There is no harm in following all those traditional methods, but salt alone, or turmeric alone, or clove alone doesn't do the need or necessary thing to your teeth. There is an ideal composition for the toothpaste, which almost all the brands of the toothpaste will follow, and all these salt, clove, and all are definitely add-ons. That's all.
Okay, okay, okay. Now let's talk about toothbrushes, ma'am. Ideally, there are three varieties or four varieties of toothbrushes. Number one, hard, medium, soft, and ultra soft. What do you refer or prefer to use personally, and probably what do you recommend for your patients?
Definitely soft and ultra soft brushes.
And how about these zigzag bristles toothbrushes, some up and down kind of toothbrushes and all? Lots of varieties are there. Do they really matter?
Zigzag, all these designs and all doesn't actually help you. It is only the way, the method of the brushing, it actually helps. You might brush, you take a small bristles or small interdental brush or any kind of brush also. That bristles, it should reach all the areas how you're brushing. Spend your time around 2 minutes in brushing and focus on all the surfaces, then you're good to go. And need not be all these designs and all. It should go in a circular motions and with a small angulated.
Okay. And when you're talking about the time you need to spend in brushing, you mentioned 2 minutes. I see a lot of individuals spend a lot of time in brushing. They keep continuing to brush at least for 10, 15 minutes. There are certain people who takes their brush in their mouth, they go outside, get the milk packets, come back to their home, and then finish their brushing. There are kids who keeps their brush in the mouth, they walk in their balcony, or they keep talking to other people and all, and maybe after half an hour or 45 minutes, they realize that they're still continuing to brush and then they go finish their brushing. So, what you mentioned 2 minutes is an ideal time. What happens if you continue to brush for longer time?
That is not brushing. What you told me is not brushing. It is just holding the brush in your mouth rather than on your, in your hand. Keeping it in mouth and roaming around and coming back, definitely you're losing your toothpaste, your time. You brush all your surfaces for 2 minutes is definitely is enough. Half an hour, 15 minutes. What are they doing then? Nothing doing it. It's just sitting in the mouth. It is she's sitting in the mouth.
Okay. Ma'am, when we talk about these toothbrushes, now we are, I think it's been there, but then, especially in this fast forward world, everything is getting automated. And I saw a lot of electric brushes too. Do you prefer or do you recommend electric brushes or manual brushes?
Yeah, why not? Electric brushes are good because, but the thing is, manual method and the traditional brushes, you have control over them. Electric
Oh.
brushes are also very good. We can recommend them. If you have a timer in the
Uh-huh.
electric brush
Uh-huh.
and you have that proper angle, proper circular movements, definitely they are a good approach for your teeth for the brushing. But then that they are expensive. It is not much affordable. Everybody cannot afford them. It is expensive for buying also and maintenance also. It needs batteries, it needs charging. Even it is your traditional brush or your electric brush, you have to change your brush in 3 to 4 months.
Yeah, that's a good question. So 3 to 4 months is what you recommend to change your brushes. Okay, great. So, ma'am, especially when we talk about brushing, I mean, there is this concept called floss, right? So flossing your teeth. So should we floss before we start brushing or after we finish brushing? When do we floss?
Ideally, according to studies like Academy of American Periodontology, they prefer flossing before brushing,
Oh,
which before brushing, which makes loosen your debris, water all there interdentally, and loosen those debris, plaque, and removal. Once it is removed and loosened, then it is easy for us to remove it with our toothbrush while washing your teeth.
oh, fantastic. That's a good study, I suppose. Ma'am, when we now talk about this floss, right? Um, I know personally two types of floss. Number one is thread-based floss, another one is a water floss, right? So what do you recommend, ma'am?
Anything is good. Thread based floss is usually what we recommend, and water based floss is also good, but it is also like it is more expensive than threads. It is more helpful in people who are unable to move, who are having arthritis, and medically compromised people who are unable to do these things with their own hands. Then this can be prescribed.
Okay, okay. And especially when we talk about this oral health, certain people will have some braces to their teeth. It can be for a lot of reasons. And what happens or what should they do if their braces hurt on a regular basis?
Any removed brackets or any removed wire or while they're brushing or any day to day while eating or something, it might cause you some inconvenience. As such, metal braces are definitely little inconvenient, but you have these things called bracket waxes, and then the proper placement of brackets and the threads usually doesn't hurt you. They are little uncomfortable but doesn't hurt you. But if at all something like this happens, you can use this waxes and all to just reduce the pain. If it is persisting, then definitely go visit a dentist and get that replaced or placed it in the right place again.
When we talk about this teeth pain, ma'am, we just discussed about what if the braces hurt. And there is another angle to it when it comes to the tooth pain for those people who do not have braces. How do they know if that pain is only on the surface of the teeth, or it is the nerve that is actually paining?
Surface of the teeth pain, usually patient don't come to a doctor. It goes down. It
Or
comes down by itself. It is a temporary surface pain. It actually hurts when you with the temperature changes, or as I told you, it is more of sensitivity than a pain.
oh,
And
okay.
if at all you say surface pain, it can be any surface in the oral cavity. So maybe when you hurt your gingiva or any there is any erosion or ulcer on the gingiva, then it can be a surface pain. But then
Okay.
when you say it is a pain to the nerve, it is continuous, it's persistent, continuous, and it is dropping. It gives you a lot of headache. Definitely, without anybody help, you will definitely go visit a dentist for a dental pain. That is a
Okay.
nerve pain.
Okay. Ma'am, how do we really have nerves right behind our teeth, or they are in the gums?
Nerves are inside the teeth, inside the gums, everywhere. Like
Okay.
there's a particular nerve that flows into the tooth, which causes all the senses for the teeth.
Okay. Okay.
When it
Okay.
gets damaged, you get that severe pain.
Okay. Ma'am, how deep are our teeth inside the gums?
You have a tooth root which is
Okay.
holding you in the jaw. The length depends on each different teeth. Incisors in a particular length, and then laterals, and then premolars, and then you have molars. Everything, every other teeth, each teeth has got its own length of the tooth, root tooth.
Okay. When we talk about this size and the length of the teeth, right? It's so fascinating and it is so wonderful. How does our teeth come outside from nowhere? Because I don't think so. Teeth is actually being hidden somewhere in our gums, right? So how does it come outside? How is this teeth produced inside the gums? What is the science behind it?
We have so-called tooth buds inside. It when the tooth grows, when the jaw grows, it moves towards the surface. Then the root grows. It comes to the surface. As it comes onto the surface and settles to a certain height, then the tooth crown is seen, and the root is inside, holding the tooth into the jaw.
Okay, okay. Now, what are the chances of an infant being born with the teeth ready with teeth ready in their mouth? Are there any chances?
There are conditions like that. It is but very few chances, around 2 to 5%.
Okay. Well, there is this case that we usually called teething for kids as well as for dogs, even for the pets. We say that, because they want to bite everything when they get the teeth for the first time. Why does that happen? What is this condition called teething?
Yeah, because that is a process of your teeth emerging into the oral cavity. It should come through the gums and the bone, and then it causes little pressure kind of thing, which makes the child kind of itching and pressure, which makes a kid infant to bite onto some other.
Some hard surfaces, right, right. There is a big complaint on the dental fraternity from general public that we have been hearing over the course of years, that they perform these root canal treatments unnecessarily. When is a root canal necessary, and when can it hold without directly going into a surgery?
Ideally, when care is start on the surface of the tooth, and it progress until the pulp of the tooth, till the pulp of the tooth, then we don't until and unless it reaches the pulp, we don't need a root canal treatment.
Okay.
But once it reaches a pulp, it is very painful, and it once the pulp is already infected, then we need root canal treatment. That infected pulp has to be removed, and the canal has to be cleaned and then sealed.
Ma'am, do these root canal surgeries also fail?
They might fail, but generally, a normal tooth structure with a proper alignment, generally it won't fail. But then there are some certain conditions where root canals can also fail when the pulp tissue is not removed properly or not cleaned properly and sealed, and otherwise, when the ill-fitting crowns are given, then it might go for a secondary infection, and then it might cause the failure of the root canal.
And this question is a little stronger one. I have seen in the news very recently that a patient went to a clinic for a teeth, some sort of a surgery, I suppose. I don't recall that exactly. And the patient's attenders have actually made a fuss in the clinic because the patient died on the surgery table. Do people really die by undergoing any tooth or teeth related surgery?
If at all, if at all there are any compromised patients with underlying medical history and that is not revealed, then mostly the problem would encounter when we given local anesthesia.
Okay, okay, but there are chances. Okay, ma'am, I've read it somewhere. Does this tooth-related surgeries, root canals, or these implants, or these smile corrections, do they actually get covered under insurance?
Insurance is a big thing in India, definitely. Some insurance companies now are giving some reimbursements. Like like when we are taking policy itself, we have to ask, like we pay for the other procedures, this premium we can ask to include, like I say, it is not previously it is not covered for the maternity, like delivery. Now it is covered. Just like that, they are giving some options for the dental thing also, where they are giving a reimbursement. But then while choosing the insurance itself, we have to be careful and ask for these procedures also.
Okay, okay. Then there is this another interesting question I want to ask you. Um, when we go for these multi-speciality hospitals, there are a lot, multi-speciality hospitals have started emerging for more than 10, 15 years, right? So the name itself says that there are multiple specialist doctors will be there under one roof. So you don't have to go to any other hospital for any other problem. But why does a dentist don't sit in a multi-speciality hospital?
Exactly. See, in India, like we have this multiple sole practice clinics in India for dental. That is to cut down the expenses, and because most of the time, generally, insurance is given for a daycare,
Mhm.
which are not usually involved in the dental treatments, which is making it little more expensive. And to cut down all these cost efficient treatments, all these private clinics have emerged more. That's the reason usually all private practices rather than in the multi.
In the multi-specialty. Okay, okay, thanks, ma'am. Then when we talk about this toothpaste, let's come back to the topic again. So, are there any over-the-counter pain relievers public can take when they have a teeth pain without consulting a doctor?
Yeah, over the counter painkillers you can take one or two, but overdosages and taking more pills is definitely harmful. We don't recommend this way. If an adult who knows well with a proper dosage can take a pill over the counter.
So there are some toothpastes. Going back to the toothpaste topic again, they say that these toothpastes will relieve your tooth pain. How true is that? How effective are they?
There are no toothpaste that can relieve pain actually. As I told
Okay.
you, there are some desensitizing toothpaste which can mask and effectively give you a relief. But then pain is definitely relieved by a painkiller, and prescribed dosage of medication has to be given.
Okay, okay. Ma'am, as a smile correction doctor, you might have done a lot of procedures, right? So I know and I've seen certain people who actually, when they smile, their gums are exposed a lot. They have very big gums. So how do you correct those kinds of cases, ma'am? Have you actually dealt with these kinds of cases? Can you explain a case study?
Usually they look good on some people, but some people are more concerned. They want a perfect smile and conscious about their smile. So those people, we can correct their gum lens. See, if there is an overgrowth of the gum, if the overgrowth of the gingiva, then we can go and correct, remove a small layer of the gum and correct to the exact level of the depending upon the size and shape of the tooth we are correcting. But then there is another options like veneers and veneers also, where you can give a proper contour to the tooth. It is actually we are correcting the length of the tooth than the even than the gum. But then when we are correcting and removing a layer of the gum, it is we are correcting a gum over sized overgrown gum, then we can give a proper exact contour to the gum.
Ma'am, what are some cosmetic procedures that are involved in this smile designing?
See, all these comes under like a gum correction, veneers, laminates, crowns. All these are cosmetic corrections.
In your experience, is there any case where you felt it was very easy, but it turned out to be very complicated for you, and it took long hours that you need to spend in the surgery? Was there any instance like that, ma'am?
Definitely. Anybody, any dentist, by seeing the patient, we feel that okay, this we can do it. But then once we start doing it, it is really a tedious and more time-taking procedure. Definitely, we need a lot of patience in correcting all these gum lines and all sorts of correction, smile correction, because patient won't be satisfied until and unless that the proper smile, cosmetic correction is really tough
Yes,
for
yes, yes,
a
yes.
doctor or a dentist to make a patient happy.
Right, right. Is there, can you explain us, maybe take one example and probably give us a case study in terms of what you have done, what happened during that case, and why it turned out to be very complicated for you, and how did that happily end?
Okay. Uh, there was a patient who has come to our clinic saying sensitivity on all the teeth. We have actually recalled to the patient again prescribing as the sensitizing paste and other types of all sorts of treatments we have done. But then finally he has come out and he himself has asked that he wants to get everything corrected, not exactly the sensitivity. He wants everything to be aligned properly. There was one teeth like lateral is little rotated, and then on observation we have got a rotated teeth, a decay teeth, and then grossly decayed teeth also. So we have all corrected these with root canals and uh, and then proper correction of the malalignment, coming into the position. See, when the teeth is malaligned, it needs more grinding, tooth grinding, and then we have given all some 6 to 8 crowns to the patient, so which has given a beautiful smile to the patient. Definitely, because
Oh,
there was before there was gap in between the teeth, and then there are caries, there is sensitivity, gap, and one malaligned and one discolored tooth. All got treated and all got solved in one go.
wow, wow. That's like a typical case where you have all types of issues in one single case itself. Ma'am, in the same manner, we are talking about missed teeth or broken teeth, or it could be gummy smiles. So there are a lot of different cases which are naturally given by the God to certain people. And they may have some reservations, and some of them may actually feel low in confidence when they actually go and smile. That's when the smile corrections are evolved and you are able to perform them. Back then, smile corrections are only reserved to people who have money. I believe now smile corrections have become affordable. Even then, public wants to know what is an ideal cost of smile corrections. I know it depends upon the complications and the complexity of the case. However, is there an average or an ideal cost of smile correction that is running in India?
No, there is no ideal cost. Definitely, there is no ideal cost.
Okay, how about a bare minimum cost for a smile correction if they have to be prepared for?
See, smile correction can be done with correcting one single tooth to the whole arch. Okay.
Okay.
And smile correction means just to give a confidence while smiling. If at all, if this is the concern, like giving a confidence while smiling, from correcting a midline diastema to even whitening of the teeth, whitening of the tooth also come under smile correction. It starts from 5,000 rupees and it may extend till 1 lakh also.
Okay, okay. Well, thanks. Well, based on so just like in general a physician's case, our urine color defines our body health, like whether we are dehydrated or whether we are correctly hydrated or not. Is there anything like that by looking at the teeth color, a dentist can tell us about our health issues?
Yeah, yellowing of the teeth, plaque, and then discolored, like a dark brown color. That means your decay have started. And there are, especially, I can tell you, when white patches just starting on the teeth, it is means that your decay is starting. White patches on the teeth, decay is just starting. Then it goes to brown, black, and then some worn out enamel will show you yellow teeth. So all these the things will show you the status, I mean health of the teeth.
Okay, okay. Ma'am, there is this conception that is actually going in the market. I have brushed my teeth thoroughly and I've, cleaned my tongue as well. Even then, I have a bad breath. Is bad breath related to teeth or something else?
Bad breath is not only related to teeth and the oral cavity, it also is related to underlying systemic conditions and gut health.
Okay,
So bad breath need not always be this way. Once you
okay,
correct, even after correcting all your oral concerns, if this persists, then we might prescribe, we might advise the patient to go for a blood test and any other test required, then correct the underlying cause.
okay, okay. Ma'am, we are especially when it comes to prosthodontics, we are talking about crowns, bridges, and implants. When do you recommend what to a patient?
Crowns, that means when a teeth is when a teeth got decayed, when you get a root canal, this is a general tendency going in the market. When you go for a root canal, the teeth needs extra strength to catch the for their daily needs, so we are placing a crown. And when a teeth is missing, with the missing teeth and the supporting teeth, we give a bridge as well. In that missing place, we can also place an implant, but implant is again subject to condition. It depends on age and underlying diseases, compromised conditions, and your bone health. All these are all required for the implant to be placed.
Okay, okay. Ma'am, when we talk about these bridges or implants or root canals, they seem to be a little expensive for some people, or I wouldn't say expensive, but they're of good chunk of money that an individual needs to invest when they need to get some sort of crowns or bridges or it comes to implants also. Do they come with some sort of a warranty or a guarantee?
Yeah, some particular crowns you get a warranty. If at all, if a well placed implant will give you a 25 years of life. Well
Okay,
placed crown will give you a 10 to 15 years of life. Definitely,
okay.
it depends on how you maintain. It is just not only just placing the implant or placing the crown. So when it gives so much of life, when it comes with a warranty, definitely they are little expensive, but they are from the affordable range to the expensive range, like any other product in the market.
Okay. In that case, let's say because dental clinics are everywhere, around the world. I may probably go from one place to another place, and I have probably taken one implant from you, and you said that it comes with a warranty or a guarantee of 10 years or 5 years or whatever it is, right? I moved on to another location, and I probably will have to go for another place, another dental clinic. How do I claim my warranty?
The warranty is given by the company itself.
Okay.
So wherever the company is present, it can take care of it.
Okay, so we need to just call the number and they will actually take care of the warranty. Okay,
Yes.
okay, got it, ma'am. Ma'am, when it comes to this crowns or bridges or implants, is there a minimum age an individual should have to go for these kinds of either smile correction or root canal? Obviously, because you just clarified it's a tooth decay, it has to be removed even for kids, I suppose. So, but smile correction or implants or gaps corrections. Is there any minimum age limit that people should actually wait until they attain that to go for this?
Yeah, when you say gap correction, when you can say there is a gap on your teeth, when your jaw is completely evolved,
Fall.
when a completely formed jaw with a completely formed teeth, yeah, then even though then if the gap persists, or if you have some missing or congenitally missing, then you can go for a replacement.
Okay, okay, got it, ma'am. And we are talking about some implant failures now. So, in your experience, or maybe not in your case, but in other cases, was there any situation where the implants have failed, and how do you correct them?
See, a properly diagnosed and placed implant is definitely a good option. But then we can actually avoid this implant failures with a proper diagnosis and proper placement of the implant. But there are definitely there are cases where there are failures of implants with infection, because there might be because of not a well maintained oral cavity, or can be because of the poor bone health, or can be because of improperly placed crown, and because it gives a constant stress onto the placed implant. So there are many reasons where your implant might fail. But that's the reason I'm telling you, when a properly placed implant with a proper diagnosis or the proper occlusion, definitely it's a good option.
Okay. Ma'am, oral hygiene in India has become a priority now for a lot of people because when we meet a lot of meetings are happening, a lot of people are meeting a lot of new people. So they really want to maintain their oral health too, starting from the breath till the way they actually look when they smile or when they actually speak, right? So how frequently do you recommend public to go for a dental checkup?
Ideally, it is every 6 months. Every 6 months, go for a routine dental check.
Okay, okay. And ma'am, if you don't mind going back to the toothpaste again, so we have heard about this charcoal toothpaste, neem toothpaste. So is are these necessary? Are these important? Because why am I asking this question is I have seen in certain parts of our country as well as in the world, people still use charcoal to brush their teeth. There are certain people who pluck neem bark and they brush using that. They don't use a toothpaste because they say it is chemicals. They don't use toothbrushes because they say it is made out of plastic. So they use this neem bark for for brushing their teeth in the morning. What is your opinion or thought on them on these things, ma'am?
Yeah, I'm not surprised because I have encountered a patient just 2 days back that she's still using
Oh,
neem bark for brushing her teeth.
okay,
Definitely, neem has got its ideal properties, antibacterial properties. Definitely, it is helpful. But then, neem bark alone will not help your teeth to maintain. Brush and toothpaste is definitely needed. Neem is a additional supplement you can give to your teeth, like how you follow the traditional methods. But then charcoal is a highly abrasive material. It should be used very cautiously, not a day, and it is not definitely recommended for the daily use.
okay, okay, got it, ma'am. Ma'am, when we talk about this oral hygiene, the immediate question what flashes in anyone's mind is oral cancer, right? What are some early signs of an oral cancer an individual needs to be worried about?
Yeah, even persistent oral ulcers coming again and again and again, even after treatment, and then it is persisting till more than 2 to 4 weeks, and there are any lumps or any extra growth in the oral cavity, just like that, without any underlying cause, any tooth discomfort, rather you say pain or bleeding or any kind of pressure you feel or any kind discomfort in the oral cavity without any underlying cause, is definitely a sign for you to go and get it screened.
Okay. What type of screenings are available?
Seeing in the oral cavity, palpating, screening, also there are dyes, but not generally recommended. But then the color and consistency of the oral cavity and the gums and the cheek and the tongue, definitely a dentist can see the oral cavity and tell you. Then if at all it is anything suspicious or anything, then we can go for a biopsy.
Okay, okay. So, ma'am, have you heard of these cases, or maybe otherwise, will you be surprised if I tell you that surgeons will be replaced with robots to do certain surgeries? Do you think that day will come?
Might be. Might be. It is emerging, but there is not yet. Not yet. It is still evolving. We don't know if at all it is really. But there will be pros and cons for every evolved method.
Okay, okay. Ma'am, there is this question that people ask again. Every doctor I go to, they recommend me to brush twice a day, which is morning when I wake up, number two, before I go to bed. Then the question is, why do I have to brush again in the morning? Because I already brushed in the night and supposedly my teeth should be clean. I haven't eaten anything throughout my night. And I went to bed right after I brushed. Why do I have to brush again in the morning?
See, once you brushed, you clean and you slept, but then the activity in the oral cavity, then production of saliva, which is more important in maintaining the oral hygiene and effective temperature in the mouth, is reduced when you sleep. It again get activated in the morning once you start eating, chewing, talking. So definitely in the morning you need to brush.
Now let's move on to some rapid fire questions. I'm going to ask you some questions where you can answer them quickly. Either it can be in one word or one sentence based on the question. So the first question is click on aligners versus braces. What is the best?
Depending upon the severity of the malalignment.
Okay. Best technique for flossing.
Traditional flossing method where you can hold the floss and the middle fingers and catch hold of it with your forefingers and thumbs, and then take it to the position and make it in a C shape and remove the plaque.
Okay. Okay. Toothpaste. Should we look at a flavor or should we look at the functionality of the toothpaste?
Right.
Okay. Okay. Uh, Brushing. Is it important we focus on the frequency or the timing, the amount of time we spend in brushing?
Minimum of 2 minutes daily twice.
Okay. So this is an important question again. Mouthwash. There are a lot of mouthwashes that are available in public. What is the role of a mouthwash in oral hygiene?
It's an add-on, but definitely it is not a supplement, or it is not
Replacement.
yeah, to the brushing. It has to be done after brushing.
Okay. Clove oil for pain. Is it effective?
Temporary relief.
Ice packs when the jaw pains. You apply ice packs on it. Is it effective?
Yeah, it is effective, but you should never apply it directly. You should put it on some cloth or any ice
Yeah.
packs that is readily available. You can use it forever for the
Got it.
relief of the temporary pain.
Got it. Last question, ma'am. Oral probiotics. Are there any benefits to them?
Yeah, just like a probiotic which gives you a good bacteria, there are oral probiotics also, like lozenges and mouth gums, where you can take it. But these are also additional to the regular maintenance of your oral hygiene. This is also an add-on. You can go for it also.
Ma'am, there is a mother who approached us and asked us to ask this question to you. She has a girl child, and the girl child is growing. She has got a milk teeth. The milk teeth has started falling off, and she started to get a new teeth now. She feels that the new teeth which she is now getting is not properly aligned. So when should she because there is a saying, right? A stitching time saves knife. So when should they see a doctor, a dentist, or a prosthodontist, so that this correction happens from the time they are actually seeing a growth in the teeth, the original teeth I'm talking about.
Yeah. When the permanent teeth are erupting into the oral cavity, there are chances that they are malaligned in front or back or rotated. There can be any kind of malalignment that can happen in the oral cavity. It also depends on the growth of the jaw, the direction of the growth of the jaw, and it also depends on the genetics of the child. So, approaching early definitely saves you more time and more proper results. That means around 12 to 14 years of age, if you approach an orthodontist, then we can also go for a functional appliances rather than correcting teeth itself. We can also correct the proper movement and alignment of the jaw.
Okay, okay. And there is this thing which parents and grandparents always say in the houses. When the child loses the teeth and when they start getting the teeth, they obviously tend to play with it with their tongue. And they say that, do not play in that area with your tongue. which will actually misalign your teeth. How true is that?
See, tongue is a very powerful muscle. Definitely, it helps you hold your teeth in place. Definitely, uh, like once it is a habit of moving that teeth, the already mobile teeth will not help you anyways. But the emerging teeth, definitely, when you push on the particular place for a longer period of time, that means daily. Once we start doing it, definitely the focus of the tongue will be there on the tooth itself. So doing it for over a period of time, that definitely there will be a little malalignment of the tooth.
Okay. So all those young kids who are watching this podcast, so whatever your mother or your grandparents are telling you is not untrue. So please bear with us until you have your teeth completely come out. So otherwise, there are chances you may have to again visit a dentist to get them corrected. So ladies and gentlemen, this has been a wonderful podcast with the doctor. If you'd like to speak with her, she's available on Medicas website as well as mobile application. The link is there in the description as well as in the scroller that you see at the bottom. You can go to our website www.medicasapp.com. You can find the doctor's name in the search bar. You can consult with her online before you directly visit her, because it saves a lot of time for you and it saves a lot of travel for you. Based on the condition, she's going to advise you as to what is the next steps in terms of the treatment or the protocol. So once again, Dr. Harika, thank you so much for your time, ma'am. It has been an excellent conversation with you. You have uncovered a lot of questions to us and cleared a lot of doubts with respect to our oral hygiene. Until we reach out to you with another episode, we really wish you all the best in your practice, and thank you once again for your time, ma'am. Namaste.
Thank you.